Okay, thank you. Good afternoon, everyone.
Good afternoon, Dr. Butler.
All right, I will just share my screen. Let me know if you're seeing my screen.
Oops. Thank you.
Okay.
Can see it, yes.
Okay, and is everyone hearing me?
Yes.
Okay, so I would like first of all, I want to thank Junior Achievement for inviting me to be a part of this Bahama Jack virtual conference this Friday afternoon. And I hope that those of you that are here will be enlightened related to the career path that you wish to embark on. I'm also hoping that this afternoon's discussion would be an interactive one, although I'm sharing my screen, and so I will talk about some things, but if you have any questions along the way, you can either ask during that time or at the end. I will be happy to entertain any questions as well, okay? So just so that I introduce myself, my name is Dr. Sabrika Pinder Butler. I am a family medicine doctor. I am one of the senior physicians or consultants at the Princess Margaret Hospital, as well as a specialist consultant in a private practice office, New Horizons Medical Clinic. I have been working in medicine from 2003 and would have specialized about 11 years ago now. And I'm now the program coordinator for our postgraduate training program with the University of the West Indies School of Clinical Medicine and Research, Bahamas. I am also the president of our consultants physician group of the public physicians in New Providence and Freeport and the Bahamas in general. And so I am glad to be here to share what knowledge I can provide for those of you achievers that are interested in the field of the medical field. And I'm glad that you do have an interest and hope that you will see this through as you start your professional journeys once you leave high school. So I know that, when we talk about healthcare in general and medical field and medicine, a lot of people automatically usually just think of a physician, but there are so many different areas of medicine: nursing, veterinary medicine, hospital administration, information technology, chiropractors, EMTs, and dentists, dental assistants, therapists, physiotherapists, and a whole list of professionals, because healthcare is now considered to be one of the largest and fastest growing industries in the US and in other countries. And to date, it seems like one of the fastest growing industries in the world. Persons in the medical field not only work in hospitals, we're employed in doctors' offices, outpatient care facilities, private practices, home care visits, and certainly I think with what we've all been seeing more so even with COVID, there's been a burst of fields that involve information technology and IT. So there are so many different areas of healthcare and in the medical field that persons can be engaged in. And so I just want to make sure that we remember that, because sometimes persons only feel that they can become physicians or dentists, but there is a wide range of good career paths related to all of the fields that are linked to medicine and healthcare. So when we look at, a potential career map, or I'm sure when I was in high school, and those of you that are in high school now are thinking about, what might be the next steps along the way. Of course, it all depends on what you're trying to achieve, but certainly a high school diploma would be something that would be certainly needed, and certainly we would always encourage you to aim for as high as you can aim. I often say shoot for the universe, and if you end up aiming and reaching for the world, at least you know that you would have at least attained some stars along the way. But certainly, once you're able to focus on your academics, that is certainly important, and maintain your grades, but it's also important to ensure that you are a well-rounded student. Those types of community activities that you can be involved in would help to shape and mold you for any career path that you would have in the future, so that you're able to deal with real life challenges, and help you to be steered along the way. So it's not only important to ensure that you have good grades, but it's important to make sure that you're well-rounded, involved in your communities, a good leader, certainly a good communicator, and those types of things. So your high school diploma, and certainly moving along from that, depending on the area in medicine that you would like to be involved in. Certain programs require diplomas or certain certifications, which you generally take anywhere from 6 months up to 18 months or more. Then other careers may require you to start at an associate level degree. Um, I'm realizing now that I missed out the bachelor's degree, which in many instances, some persons go on to completing without necessarily doing a 2 or 3 year associate's course. And then depending again on what you might wish to do, you might want to do a master's degree. In various instances in healthcare, persons might have a master's degree in public health, for example, or a master's degree in nutrition, and all sorts of other areas. So that is also a degree that may be useful depending on the area of interest. Persons also go on to do a PhD and become professors, may be involved in research, may be involved in academia and teaching. And so that is usually where those types of degrees become very, very important. And then certainly when we talk about careers in medicine, specifically physicians, veterinarians, dentistry, depending on where you go, may be a MBBS or a bachelor's in medicine, bachelor's in surgery, or a medical degree, MD degree, if you study in the US. And that would be the next step. And moving on from that level, once you've become a physician, and then you need to specialize, or if you decide to specialize in another area of dentistry or veterinary medicine, for example, you might go on into other courses of studies and do a specialization and or a fellowship after that if there are further areas of interest. I will pause here at this moment to entertain any questions that any of you may have, or if you'd like me to clarify anything. Okay, so I think this quote on the side actually is one that's fitting. If it were easy, everyone would be a doctor. This is the best job in the world. Certainly it's the best job in the world to me, despite everything, because of everything. And I think in our times of crisis, like a COVID pandemic that we're experiencing now, or when we have, casualties and different things happening, in the country. Sometimes it may seem challenging because there is a lot of hard work to be done. But at the end of the day, if you pick a career path that you are passionate about, one that you know why it is that you wish to be involved and engaged, one that allows you to find various ways of being satisfied with your job, whether it is that you're interacting with patients, whether it is that you're involved with research, whether it is that you're involved with technology, education, the laboratory, anything that you decide to do. I think it's very important for you to make sure it's something that you really want to do, something that you're passionate about. And so that at the end of the day, whenever things may seem to be challenging or you have to put in a lot more work, you're able to still get joy and feel some sense of accomplishment. So I think that it's important to appreciate that, you know, when you're talking about the medical field and the healthcare field, that there are certain qualities that you want to even examine within yourself. Even now, if persons haven't already spoken to you and said, you know, I think you're a compassionate person. You know, that's certainly a good quality to have if you're going in the healthcare field and you're intending to interact with patients. You want to make sure that you also are someone that's resilient, because again, depending on your career path, you may need to be in school for varying amounts of years, anywhere from, we said, 2, if you want to be a medical doctor, depending on where you go, it could range from 6 years up to a total of maybe 15 in total, considering your specializations and your fellowship. And I know sometimes when we speak to that to some persons, it seems like it's so long, but believe you me, the time goes away very quickly, especially when you're enjoying what you want to do and you've set goals towards it. I think one of the other things which ties into the next quality that I think is very important when you're considering medicine is understanding and appreciating the role that you would have as becoming a lifelong learner. Because certainly in medicine and with the ever changing advances in healthcare and technology, you always have to be learning about new things, keeping up to date with patients, clients, their needs, their wants, being able to adapt to various changes in our society. So those things are important. And so that would make all of us want to ensure that we're a lifelong learner so that when you do have to revisit certain skills that you would have learned some years ago, it wouldn't seem like such a challenging task because you'd be prepared for it as you go through life. Certainly another quality is having excellent leadership skills. I think in any career that is important, but certainly in healthcare, because a lot of persons look up to persons in medicine and they have their expectations for the profession. And with that comes your leadership skills, being able to work with others in the field. Sometimes you have to work with students. Sometimes you have to work with other physicians who are also in training. You have to be a part of a team. So you have to know how to lead and you have to know how to be able to communicate. Absolutely important. Sometimes in the area, you're not giving the best news to patients or their relatives, and people can take that in different ways. So you have to be able to know when to say certain things, how to say them, and in the environment with which it would be most appropriate depending on the circumstances. So those would be some key qualities that I would say for those of you that are interested in medicine, that you would want to, you know, do a self-reflection and ensure that they're there. And if you don't think that you're as sharp of a communicator as you might need to be, there's, you know, it's never too late to build on those qualities, surround yourself with persons who have similar attributes and, you know, allow yourself to continue to build as you go on throughout your life and knowing where it is that you would like to be at the end of the day. So why choose medicine? And if I can just ask at least 3 of you to tell me why you would be interested in medicine, if you can share with us. I don't want to call names, but I know that I can. Sharika Miller, is your mic open? Are you going to share with us? Are you guys able to unmute your mics?
I can go.
Okay,
Okay.
thank you.
I like helping others. I'm interested in kind of sciencey stuff like chemistry and biology, and I like the pay.
Okay, okay. So there are good reasons. Anyone else? Is Shelley Stewart still with us? Can you tell me why you choose medicine, if that's the person, that's the name I'm seeing? Okay, everyone is very, very quiet today. Nora Leak Roll, are you with us? Are you able to share?
Yes, Mom.
All right, go ahead. Tell
I
us why
chose
you're
to be,
interested.
I chose to be a veterinarian because I like helping like animals and stuff, and like the pay, like the other girls say, and I like interested in chemistry too to an
Okay,
extent, and yeah, I just think it'd be fun to just be around animals all day and to help them.
all right. Anyone else? One more person and then we'll move on. Is Annie Beckles still on the call?
Annie Beckles is not a student.
Okay. Do we have any other students on the call? All right, we'll move on then. So I think those of you that shared gave good reasons why you were interested in medicine. I heard a lot of you mention chemistry. That was actually my first degree and still one of the areas that I love most. And certainly the sciences are good areas to choose: biology, chemistry, mathematics, although you don't have to necessarily major fully in all of them, but just ensure that you have the right balance so that when it's time to get fully engrossed in your programs, depending on where you're looking at going, they will look to ensure that you have that science background. So just to keep that in mind, because persons, may have done other things and do a pre-med or a pre-vet that would have allowed them to also have similar opportunities, but agreed that you would still want to ensure that you do some science courses. So, why choose medicine? It's a service area. It's always good to render service, whether it's to people, whether it's to animals, helping people, helping others get well and be healthy is always a good thing. It's a field that allows persons to be respected. Certainly a lot of persons in community. It's a noble profession. It's always been known to be a noble profession. From the Greeks times of the Greeks and still is today. And so that is always something that we want to maintain in the profession, which is why it's always important as healthcare professionals for us to also speak with other persons who are interested to make sure that they understand the role that they play when they become healthcare professionals. Generally, it's a pretty stable job. Again, going back to the high demand for healthcare professionals in almost every part of the world. You're almost ensured to have a job or at least to be employable. And certainly at this time, that's most important. And it allows you to be able to be employable in not just the Bahamas, but in other countries throughout the world, very high in demand. So I think that's certainly important. The financial backing or aspect of becoming a healthcare professional or physician is something that is also a good tool. I think that depending on the area you go in, that determines the amount of monies that or income that you may be able to maintain or achieve. However, I wouldn't want that to be the focus of why we enter a career, but certainly it is one to make note of because depending on the area you go into, you may have to spend a considerable amount of years. And so that generally balances off for you at the end of the day. Having said that, the balance comes with hard work as well. So just to keep it in mind, because I know sometimes people can, think that they may not have to put in as much work, but it does pay off at the end of the day. Certainly, it's a satisfying career, especially if it's one that you're passionate about. The diversification that we touched on earlier allows you to be able to go into all sorts of different aspects, and you can do all of them at one time. You can focus on one area, and you can choose to do different areas at different stages of your career. And I think that's very important. And it's also a very progressive career in the sense that there are always so many new things happening. You always have to keep up to date. The technology allows you to align yourself with persons locally, as well as persons within the region and in other parts of the world. So I think that that is also very good when you're looking at choosing a career. So in summary, I just want to say or leave with you that I think that certainly good medical professionals are always needed, always needed. You can't go wrong with choosing a career in medicine. You will always be able to find a job. You will certainly, if you have interest in the sciences, it will be something that will allow you to use those tools. You'll be able to help others. You will be able to be available for work, not just in the Bahamas, but in other places. And I think that when we talk about healthcare and making sure that our society is a healthy one, we know that that's one of the things, in order to be a good nation or to be progressive, certainly we have to ensure that we take care of our health first, because without that, everything else falls to waste. So with that being said, I would think that it would say to us that medical professionals are certainly a priority area. And so I think it's good, and I want to encourage those of you that are interested to continue to be encouraged to make your mark, to achieve your career goal, align yourself with persons that are in the field, so that if you do want more information, or if you want to have a feel of what's going on, see if you can work or visit offices, hospitals. I know this isn't quite the time with COVID, but at least if you reach out even to the veterinary doctors, for those persons that were interested, certainly they may be able to provide you with other helpful tips that may help you as you go along your career paths. If there are any other questions for me, I would be happy to answer them for you at this time.
Okay, if there aren't any questions, give you one more opportunity.
The only
Okay.
other thing, sorry, I would probably mention to the group, just as they're thinking about choices, is if you haven't already started, but I'm sure you might have already been looking at the various places that you can train, whether it be in the Caribbean, Jamaica, Barbados, Trinidad with the UWI, whether it be in the United States or whether, you know, your start is locally at the University of the Bahamas, which is where I started with my associates, then my bachelor's. Then I matriculated to Florida A&M for my bachelor's and ultimately ended my medical career at UWI Trinidad. And then at home, because there are a lot of postgraduate programs available locally. So things to just think about when you're talking about the costing of education, because certainly more so in the US, the cost of medical school is very high compared to the region. And so there are various opportunities that you should perhaps listen out for. See what might be necessary for you to align yourself with getting scholarships, and then continue to talk to other persons in the field so that we can give you advice to help guide you as you go through this process, so that it can help you and your family members who will be supporting you financially and otherwise through this journey. Thank you.
Thank you.
Okay. Was that a question? Sorry.
No, ma'am, I was saying thank you to Ms. Butler.
Okay, not a problem. So just want to say thank you, Dr. Pinda Butler, for the time for presenting to the students. We will make the presentations available to the other students that would have registered and was not able to participate.
Okay, thank you
Okay.
again for having me, and my pleasure to have been a part of this process with you this afternoon.
Great, thank you. Students, if you can just stay on for a moment once Dr. Pinda Butler leaves the room, I just want to give you an update. Okay, so just a reminder that we do have an evening session. We have a scavenger hunt starting at 7 p.m. We're going to use this time because we feel as if we're going to have a better response with the fun activity. We will use that time to, again, reintroduce you to your group members, especially for those that have not met their group members as yet. So you can become familiar and join the group and be a part of the pitch competition. So we hope that you are a part this evening. And if you know anyone else that have registered who have not